Hi everyone, this is Dr. Cole Handy Jones here with your Handy Physical Therapy tip of the day. Today I want to talk about 10 exercises for your low back pain to help you get feeling better. Let's get started. It's no doubt that low back pain is an absolute epidemic. It is definitely the most common thing that I see in the clinic, making up about 50% of my patient population. So I'm no newbie to treating back pain. These exercises that I'm going to show you are more general exercises. It's not for any specific diagnosis, rather just simple things that you can try to see if they help you get you feeling better. These are all fairly low level, meaning they're good if you're really painful right now, you've had back pain for a long time, and just simply don't really know where to get started with, okay? Try these ones. If any of these things make you feel worse, listen to what your body's telling you, okay? A little bit of discomfort's okay, but we definitely don't want much with any of these. So if you start to have more and more pain with these, back off and try other ones, okay? There's no doubt that in these 10, you'll find ones that you like more and one that you like less. Do those ones that you like more or make you feel better more often. Those ones that you like less, especially if they're giving you pain, don't do as often. So let's give these a try and get better together. Okay, so these first few exercises that I'm going to show you are going to require you to lay down. Most of these you can just simply do on your bed or perhaps a couch. Some of these a little firmer surface work better, so if you can get on the ground, better. But I always tell people if you're going to get on the ground, simply make sure you can get off the ground. Okay, so be really careful if you try these at home. Okay, so first exercise I want to show you is called a bridge. Okay, this is one you've probably seen before. Laying down on your back. Okay, I want you to bend your feet up. Okay, you're going to take your butt and try to lift it up off the ground by squeezing your butt cheeks together and back down. Every time you lift, folks, I'm going to squeeze those butt cheeks together and then come back down. Okay. Working those butt muscles are really important to getting back from back pain, okay? First of all, because every time that you fire your butt muscles, you also contract your deep back muscles. These are the ones that really control your vertebral column. Also, when we move and lift and function, our butt and hip muscles should be the big drivers, not necessarily our back muscles. So by getting our butt muscles to work better, more efficiently, and be more coordinated, it can take some stress off of our low back, okay? So this first one that I want you to try is the bridge. Okay. Now, if that's painful, you have a couple options. Number one, perhaps the most simplest, is you can actually just lay just like this and just squeeze your butt cheeks together. Okay. Lay and squeeze your butt cheeks together. Hold for a couple seconds and relax. Okay. Even people who are really flared up or have a lot of back pain usually can do this exercise. Okay. The next step would be then just trying to lift your butt maybe an inch off the ground. Okay. So same thing, squeeze your butt cheeks together and just lift ever so slightly and back down. Okay. As you feel better over time, you can start going higher and higher and higher to eventually where you can do a full bridge, but just start small and see what your pain level will allow you to do. The next exercise that I'm going to show you is called the pelvic tilt. This is a great one that works your deep abdominal muscles, also while providing a little bit of mobility or stretching to the low back. Okay, so once again for this one, I want you to lay down on your back and I want you to bend your knees upwards. Okay, this is a weird movement, but what you're going to try to do, take your pelvis, and I want you to try to roll it backwards like you're trying to flatten your low back on the table or the ground. Hold for a second or two, and let that relax. Roll your pelvis backwards, hold for a second or two, and relax. And you're just going to keep doing this motion, okay? Some people have a really hard time with this motion. It's very foreign or different to them. And if that's you and you're having a hard time kind of coordinating this and get it to work, you have a couple options, okay? The first thing you can do is you can take your hand or even a towel and put it underneath your low back, okay? And simply picture trying to crush your hand or that towel. So holding my hand right here, I'm just gonna try to crush that down, hold it with my back, and let it relax, okay? You can also have a towel there that kind of gives way as you do it, okay? Another thing that you can do for yourself is you can actually grab onto your hips here and try to manually pull them backwards, okay? Sometimes just giving yourself this little bit of a reminder helps you do it a little better, okay? So with my hands here, I'm very simply trying to do this motion on my hips, okay? And once again, this is working my deep abdominal muscles while also providing a stretch or an opening sensation in my low back. I think you'll really like that one. If you have pain with this one, All you need to do is not go quite as far. Okay, so you can see when I'm doing this right now, I have pretty good motion. I can go pretty far with this, but if you're having pain, just go a teeny tiny bit. So just subtly start that motion and let it relax, okay? And as you feel better, go further and further and further. The next exercise that I want to show you is called a transversus abdominis contraction. So your transversus abdominis is one of your deep abdominal muscles that sits very intimately up against and controls your spine, okay? If you've ever seen one of those weightlifters lift weights, perhaps a squatter or a deadlifter, you've seen them wear one of those big belts. This is the muscle that does a very similar things in our body, okay? So what it's going to do is provide that stabilization to our core and our low back while we do different movements and things throughout daily life. So this is really important to get this stronger and working better. Oftentimes people with back pain, this muscle doesn't necessarily truly get weak, it just becomes uncoordinated. It doesn't turn on and turn off as it should. And this is what this exercise is going to really teach and help us hone in, okay? So for this one, lay down on your back, okay? For most people, you're going to feel better with your feet up like this. For some people, if you have a really acute or new disc injury, your feet might feel better down, and that's okay if you need to do that. For most people though, I'd be willing to bet this feels a little better on your back, so probably have your feet up, okay? For this one, first and foremost, I'm gonna have you take your hands, and I want you to find your big hip bones on the front of your hip, okay? So usually people have these protruding hip bones. I want you to find those, and I want you to put your fingers right inside of those bones and just feel your abdominal muscles, okay? This is gonna let you know if those muscles are actually contracting and working as they should, okay? So I'm gonna describe this a few ways of how to turn on this muscle because it's kind of weird and hard to do for a lot of people. So the first thing you can picture doing is I want you to picture taking your belly button and pulling your belly button in towards your spine, okay? So I'm gonna take my belly button, draw it in towards my spine, and what I should feel here with my finger is a subtle flattening out of the abdominal muscles in here, okay? So relax. Take your belly button, draw it in towards your spine, hold, and relax, okay? I don't know if you can quite see it there on my screen, but I can feel my abdominal muscles protruding ever so slightly and becoming a little more firm, okay? If you're having a hard time with that and you're not quite sure if you're doing it right, the next thing you can try to do is very simply try to picture taking these bones and pushing them apart, okay? Not with your hands, but with your abdominal muscles, okay? So watch my fingers here as I try to push those bones apart. My abdominal muscles contract and they relax. Once again, I try to push them apart, contract, and relax, okay? Now, if you're having a really hard time with those two, this is the last kind of fail-safe that I use that most people finally get, okay? But this is weird. What you're gonna do, you're gonna make a s sound, so kind of a hissing sound, okay? So I'm gonna do the same thing, I'm gonna go s, s, s. Every time I do that, automatically, these deep abdominal muscles turn on, okay? So if you tried the first two things and they didn't work for you, try this one, okay? This should definitely turn on those abdominal muscles. And honestly, the first little bit, I would just do that for all your reps, okay? As you feel better, try not to do it without the s and just being able to turn those muscles on without it, okay? But that's a great fail-safe for you to know that you're turning on the right muscles. I usually tell people too, when you do this one, this isn't a big giant bearing down, trying to contract these muscles as hard as you can. It's more of just a subtle flattening out of your abdominal muscles, okay? So for me, I've taught and done this now for so many years, it's just automatic. I barely have to think about it. That muscle can turn on and turn off. The next thing I want to show you is a way to work your hip adductors or your groin muscles, okay? These groin muscles are very tied into the hamstring muscles, which really helps control our pelvis. This is another great way that if we can contract our groin or our thigh muscles, it helps all of our back muscles really relax. And that's why I like this one more than anything. If you're really painful or flared up, no doubt your back muscles are all going to try to really grab and hold and control your spine. So this is a great way to get it to relax, okay? So for this one, all you need is a pillow or perhaps a rolled up towel or blanket or something like that. So for me, I've got a pillow right here. I'm gonna use a pillow, okay? I want you to lay on your back, okay? Bend your knees upwards. I'm gonna put the pillow right in between my knees. All I'm gonna try to do is squeeze my knees together as hard as I can go. Hold for a second or two and relax. Squeeze together, hold, and relax. So like I said, once again, if you're really painful, acute, or more that just have long-term pain, it's become really, really uncomfortable, this is a great, very simple one that most people tolerate really, really well, okay? There's not a right or a wrong distance to the pillow, okay? If that doesn't feel quite so good, you can even take the pillow Bend it in half, or do it the other way, make it just a little bit wider when you do it, okay? But every time you contract, hold for a few seconds and relax, okay? And by working all these muscles, it lets all the muscles in the back really relax and breathe while something else is turning on. The next exercise that I want to show you is called a Kegel. You may have heard of a Kegel. It's often an exercise that is given to women pre or post pregnancy to help strengthen their pelvic floor. So I'm sure you've heard the term core stability. When we talk core stability, there's a front to our core, there's a back to our core, but there's also a bottom and a top to our core. Now the bottom of our core is our pelvic floor, okay? These are the muscles that we really need to control and help with our back, and often ones that I find that are forgotten or not worked very often, okay? So this exercise is kind of weird, so bear with me as we try to kind of learn it together. But yeah, let's get started. So for this one too, I'm gonna have you lay down once again, okay? Usually knees up are gonna be the best position, so probably have your knees up. I'm okay with you having them down if that feels better to you, but for most people, it's probably gonna be with knees up, okay? So in order to contract our pelvic floor, it's kind of weird. What you're gonna try to do, I want you to picture that you're urinating and trying to stop your stream, okay? This is not an exercise you're gonna be able to see, okay? But what I'm trying to do, picture stopping my stream while urinating, holding for a second or two, and then letting that relax. Pull up that pelvic floor, stop your stream, and then relax, okay? If you're a guy, you have a couple options to think about, okay? I actually think it's a little easier if you're a guy. One, picture trying to lift your testicles about an inch, okay? Just using your muscles, okay? So I'm gonna try to lift my testicles, hold for a second or two, and then let it relax. You can also picture that you're going down into some really cold water, and you get right to about there, guys, you know what's gonna happen, right? You're gonna kind of naturally just lift those testicles and hold them, okay? You can do that. For women, sometimes I think it's a little harder to kind of get a grasp of, okay? But just try to picture stopping that stream while urinating and then trying to let it relax, okay? One thing that you can try if you feel like you're not quite sure you get it, the next time that you're urinating or using the toilet, try to stop your stream and see if you can, okay? That is not something that you want to do frequently. If you do it frequently, it can start to cause urinary tract infections and things like that, but just once or twice won't be a big deal. So the next time you're going to the bathroom, try to stop your stream and see if you can. The next exercise that I want to show you is a really easy and almost a lazy exercise. This is a really feel-good thing for people with really acute or flared up back. So this is called a 90-90 diaphragmatic breathing, okay? What that means, at my hips are gonna be at 90 degrees, my knees are gonna be at 90 degrees, and I'm gonna be breathing using my diaphragm. Now that's the top part of the core that we were just talking about. Okay, so for this one, all you need is something to be able to put your legs up on. So for me, I just grabbed a chair. That's gonna work really easily. I can even put my legs up on the couch or something like that, but you just need something to be able to lift your feet up. Okay, so I'm gonna lay down on my back. I'm gonna put my feet up on this chair, okay? You can see that I'm 90 degrees at my hips approximately, and I'm approximately 90 degrees at my knees, okay? And all I'm gonna do is lay here, okay? I'm gonna take one hand, put it on my belly, other hand, and put it on my chest, okay? And all you're trying to do while you're laying here is breathe with your belly, not with your chest, okay? When you breathe with your belly, that means that you're using your diaphragm and not using these chest muscles like we should, okay? So when we breathe, I want you to go in through your nose, out through the mouth, focus on lifting your belly, so that's why this hand is here, and not your chest, that's why this hand is here, okay? So in through the nose, and out through the mouth. Just like that. You can do this for as long as you want. 5 minutes, if not more, is usually pretty good for people, okay? But this is gonna be able to totally relax your back muscles while working on proper breathing and working on that diaphragm control, okay? Lots of times, especially nowadays, we breathe a lot with our chest because a lot of us have that desire to have a skinny waist and belly and more of that inverted V, those bigger shoulders and bigger chest. So by learning to rebreathe with your belly, not with your chest, it's really going to help with that diaphragm, which is going to help with back pain, okay? And I think this will feel really good, so you'll like this one. Give it a try. The next exercise that I want to show is called a bird dog, okay? This is one of my favorite exercises. If you've been following my channel long, you've seen me show this actually a few times now, but I would like to remind you of it and show you it again because I think it's a great exercise to do low load on the spine while trying to strengthen it and teach proper biomechanics. Those are movement patterns, okay? So for this one, what you're gonna do, you're gonna get up on all fours or hands and knees, okay? When you're on your knees, I want your wrists underneath your shoulders and your knees underneath your hips, okay? While in this position, your goal is to keep your spine as straight and stiff as a board while you move, okay? So for me, I'm gonna pull my chin in towards my Adam's apple a little bit. I'm gonna push ever so slightly up through my shoulder blades, okay? And I'm trying to keep my low back and whole spine as straight and stiff as a board. While I'm in this position, I'm gonna take opposite arm, opposite leg, straighten them out from each other, and then come back. And then do the other side out, and back, okay? I'm not concerned at all with how high your hands are going up. I'm just concerned that your spine stays stiff and straight while you move, okay? Back and forth. If that's too much and you don't think you can do it, I would just simply start with one extremity at a time. So same thing, get in your starting position, just move one arm, and then come back. Other arm, back, leg, leg, just like that to begin with, okay? I actually did a whole video on this exercise, so I'll put a link at the very end of the video that you can go and check it out if you like this one and want to do it more. This next exercise that I want to show you is called a quadruped rock back, okay? The important thing about this one is trying to relearn proper movement patterns with our back. If you have back pain, especially if you have back pain for a long time, your body has probably started to compensate and move a lot differently. Our body is really good at adapting, sometimes to a fault, okay? So what I want to try to do is reteach those proper movement patterns, okay? So for this one, you're going to get on all fours, okay? All fours is what quadruped means, okay? I want your wrists underneath your shoulders and your knees underneath your hips. Your goal with this one is while you move to keep this low back nice and flat, okay? So all I'm going to do while I'm in this quadruped position is bring my butt down towards my heels while trying to keep my back nice and flat, okay? I'm just gonna go back and forth, okay? This is not one that you really feel working, nor necessarily stretching, okay? But my goal is to keep my back nice and flat, okay? So the most common thing that I see when people rock back is one of two things, okay? Either one, they come back and their butt really rounds, and their back flattens, rounds out like that when they move. That's not what we wanna do when we do different movements. Or they come back and their back actually starts to arch when they come back. If you can see those differences, okay? That is not what I want you to do. So your goal, keep that spine nice and flat and straight and simply bring the butt back down towards your heels, okay? This is gonna help you relearn keeping that spine stiff and rigid and flat while you do different kind of movements. The next exercise that I want to show you is called a clamshell. Okay, the clamshell is one of my favorite exercises for any lower extremity injury. It really helps with back pain, hip pain, knee pain, and in some cases, even foot pain, okay? So for this one, we're really gonna work those hip and butt muscles to help control our pelvis and our low back, okay? So for this one, what you're gonna do is lay on your side, okay? When you lay on your side, I want your shoulders, hips, and ankles all in a line, almost as if there's a straight wall right behind me. I'm gonna have my knees bent to 90 degrees, okay? Then what I'm gonna do laying down like this, I'm gonna take my knees, spread them apart like a clamshell, and then come back together, okay? We're just gonna go up and down. I want you to think about going about 2 seconds up and about 2 seconds down, okay? With this exercise, one of the most important pieces is not to let your hips roll backwards. So when I lift up my knee, what often wants to happen is my hip wants to roll backwards like this, okay? Because we're trying to get that knee higher. What happens then is I'm working other muscles and not really isolating these hip and butt muscles. So what I often tell people is you can even put your hand behind your butt and keep it forward, okay? Or what I like to do is actually just put my other forearm down on the ground, and that really keeps me from rolling back, okay? So I'm just gonna lift up and down, okay? This one I tell people too should be a real burner. You're gonna feel a good workout burn in the side of the hip and back into the butt a little bit, okay? If you're feeling that burn, you know that you're doing it right. This is one too that I would do on both sides. So to conclude these 10 exercises, the last thing that I want you to do that you might seem are a little bit silly or not very applicable to back pain, but research really says otherwise. The two things that I really want you to focus on doing more often than not is walking and or biking. Both things have shown to be really effective with back pain patients, okay? So biking. One, if you have a road bike, a sit-up road bike, start biking, okay? Sometimes being in that position and moving your legs can relieve a lot of back pain, increase blood flow to the area, and just get things kind of moving and grooving again, okay? Or even simpler than that is just simply walking, Okay, start trying to walk more and more and more. Okay, there are certain conditions that like walking more than others, so I would just take what you can get. Okay, if you get out there and you find that you're walking for 30 minutes and that's giving you a ton of pain and that pain lasts for a long time, don't go that far or that long. Just start small, more like a few minutes. There are some conditions that love walking, so if you walk 30 minutes and you feel pretty good with that and actually seem that it helps your back pain, well then walk more. Okay, but walking and or biking are huge things for low back pain.